What's one thing that people say in your profession that's pretty much always a lie?
This isn't always a lie, but it is one of the biggest myths or lies that we have, that polycystic ovaries actually aren't ovaries with cysts, and having polycystic ovaries doesn't mean you have PCOS. So let's unpick that. To meet the diagnostic criteria of PCOS, women have to have two of the following three criteria. One, irregular periods or no periods. Two, signs of increased levels of androgens, giving symptoms such as excessive hair growth, acne, hair loss, might have difficulty putting on weight, losing weight, and also enlarged ovaries with lots of small follicles containing immature eggs, known as polycystic ovaries. But research among women and clinicians has found that there is a confusion over the name of PCOS, which makes the diagnosis even more tricky for women who have the condition or unfortunately are misdiagnosed with the condition. So like I said, polycystic ovaries aren't ovaries with cysts. It's just a number of highly immature eggs and follicles. They can also have cysts as well. But having polycystic ovaries doesn't mean you have PCOS. So the limited evidence about the condition means that a large number of misinformation online is fed, and therefore you get more common misconceptions about PCOS because the name itself is very confusing, and these myths and assumptions are harming women and standing in the way of effective diagnosis, appropriate healthcare, appropriate follow-up, because PCOS is a whole body, not just a gynecological, but a whole body, lifelong endocrinological condition that can have other implications for the women who have the whole syndrome, which can affect them, such as it can lead to metabolic syndrome, risk of type 2 diabetes or risk of diabetes, can lead to risk of heart disease, impact their fertility, impact their psychological symptoms. So half of women who have PCOS, polycystic ovary syndrome, are at increased risk of depression, and also be an implication for other conditions. So we know between sort of 40 to 70% of women who have PCOS could also have endometriosis as well. And also it can increase the risk of endometrial hyperplasia. So we need to get the diagnosis, we need to sort out the name itself, but also we need to make sure that once we get the diagnosis for women, that we actually have a follow-up plan for them and follow them through the whole of their life, like we do with lots of other chronic diseases, but we just don't do that currently in my profession. And that I just wanted to highlight.